And one of the things that really has driven our research program has been the features of the experience that arise that really map onto naturally occurring mystical type experiences. And this is just showing dose-related increases in post-session ratings of mystical experience after increasing doses of psilocybin. And this turns out to be a very robust construct. We have put together a mystical experience questionnaire. These are the domains, and the OM group did give this questionnaire to some of the OM practitioners, which seemed to show a signal. But there's this sense of the core sense of unity, this interconnectedness of all people and things. It converges with a sense of preciousness, sometimes sacredness, which fits with, you know, Andy's observation that's the overlapped with spiritual experience. Noetic quality, sense of encountering ultimate reality, deeply felt positive mood, transcendence of time and space, in ineffability. And we've constructed this questionnaire, done psychometrics on it. It's a 4-factor structure with this unity, preciousness, and noetic quality being a mystical factor. But it provides a nice, robust measure of something we think is really intriguing. And the point I'm going to make in just a second is this is really predictive. Post-session ratings of mystical experiences is really predictive of long-term positive outcomes, be it in healthy volunteers or symptomatic unhealthy people. It's not surprising, you know, mystical experiences, you know, are described as mystical, religious, peak, transcendental experiences, you know, epiphanies. And here's another factor. I mean, we really don't know what's pulling the weight behind the transformative effects here, but psychological insight, we're convinced, is really important to this as well. And it may be a supplementary or complementary factor to mystical experience. And that's interesting because it really resonates with what Greg was saying about how some people for some of these sessions are doing the work and others are giving in, allowing themselves to launch back into larger states. And we think both are operative here.